Hello everybody. Today we are going to review the Driveline dressing kit intended for dressing changes every 3 to 7 days. First, start out by cleaning the area that you are going to work at. Once you get the kit out, the outside pouch will contain components needed to remove the existing dressing. You can apply your mask and gloves. These gloves are not sterile because we're removing the old dressing. Discard the old dressing. Look for signs and symptoms of infection. The bottom of the outside pouch contains walleted gloves and hand sanitizer to be used when performing the sterile dressing application. Set those aside for now. Step 1. Sanitize your hands with the hand sanitizer gel provided. Then put on your sterile gloves. The kit contains both CHG swab sticks and betadine sticks. Use whatever cleanser method that your provider has recommended. Step 2. When applying the cleanser, don't forget to include the Driveline exit site, the Driveline itself, and around the area. Clean for 30 seconds. And don't forget to allow the site to dry for 30 seconds. Step 3. You will lightly dampen the surface of the Silverline dressing with the saline wick provided. Silverline is a CHG-free antimicrobial sponge that can be used by all patients to help protect the Driveline site. In order to ensure easy removal, place the Silverline dressing silver side down around the Driveline in such a way that the Driveline rests upon the slit portion of the Silverline. Step 4. Apply skin prep to the area where the dressing will adhere, avoiding the insertion site. If you notice excessive drainage, apply a 2x2 gauze on top of the Silverline. Next, we will apply the dressing. Ensure that the closure piece is under the Driveline and over the dressing, as demonstrated by Sarah. The last step, step 5, is only needed if you have to reapply your anchor. You'll have the anchor, the alcohol prep pad, and the protective wipe. Clean with alcohol prep and allow to dry. Then apply the skin prep and allow that to dry. Use the anchor to secure the driveline approximately 2 to 3 centimeters away from the dressing. The anchor is changed on an as-needed basis. Applying the anchor allows some slack. Pull the tabs as demonstrated by Sarah.